So hello everyone. Am I clearly visible and audible to you people? Let me confirm it. Give me 1 second. I will confirm if I am clearly visible and audible to you people, then I will start it. Just a second. Just one more second. So okay. Uh, Keep it here. Okay. So I welcome you all for today's session. A very good afternoon to all of you. I am Dr. Priyanka Sachdev here, NEET PG educator on Unacademy. So today I am here to do NEET PG 2021 recall and analysis. So we together will do the recall. You people will help me in recalling the questions. Most of the questions are recalled by many students, we know. So, but some of the options and some of the information is missing in it. And we will do the analysis also. We will do the analysis of the questions also. So finally, NEET PG 2021 is over. It is done. It is a big relief after so many postpone. There was such a frustration inside the students. Then when exam is going to happen? So first time it was postponed. Some of the students were happy we got more time, but it was postponed again. So it was really too much time. The students got frustrated, and really all of you wanted the exam to be done as soon as possible. So finally it is over, and it is a big relief for all of you that exam is done. So very good. So let's do the analyze. Let's analyze the questions. So how was it? First, you tell me how was it. Let me see if I can see your chat. Okay, I can see your chat. So how was it? Was the paper easy? Was it moderate or was it tough? So how was it? I have asked to many students also. So many students have responded me on personally on the Telegram, on WhatsApp. So what is your overview? Was the paper easy? Was the paper tough or was it moderate? So, okay. So most of the students have told me that the paper was moderate. It was neither too much easy nor neither too much tough. It was towards a little bit easier side only, you may say, but it is not tough at all, because most of the questions are relatively based on the basics. So those who have given the exam, they already know, as compared to the INICT, we were expecting more IBQs in this exam, more image based question. But as a whole, we have only 25 or 30 IBQs in the entire paper. So IBQs were relatively less. Yes. And we were expecting big lengthy integrated questions in the paper. So that's why we were preparing you for that, and we have done practice for that also. But the integrated questions were relatively less, and we were expecting many COVID questions, but there was not even a single COVID question in the paper. These were the some of the expectations which were not fulfilled in this paper, and we were expecting these things, and something else has happened. And in the paper we have seen most of the questions were one liners. They were based on the catchy points of the diseases. They were based on the pathognomatic features of the diseases. Yes. So yes or no? Give me an overview. What was it? I have not given the exam. You people have given the exam. So you are the better person to tell me what was exact scenario. Was it that IBQs were relatively less now, as we were expecting more IBQs? We were practicing it since long for this day. We were expecting more lengthy integrated questions, but there were no, and we were certainly expecting some COVID questions, but there were no COVID questions on the paper. Yes or no? So that is the feedback given to me by most of the students. Now there is a disclaimer. I will explain the pathology. I will take the pathology portion of the questions, but the disclaimer is that the information is based on the answers will be based on the information given by the students. So the answers can change from 4 of the options. I will tell you what currently I feel the correct answer, but later on in detailed analysis, maybe I will say some other option if some other information hidden in the question which is not given right now by the students, if it is coming later on. So we will do a detailed analysis later on. Let's see the questions at the first glance how it was. So this was the first reaction, first glance of the students given to me, that ma'am, paper was relatively easy, as we were expecting big lengthy questions. IBQs were not there, but relatively easy, catchy points, one liners were there, and it was, the time was also sufficient. It was not a lengthy paper. Most of the students get extra 15 to 20 minutes in the end after finishing the paper. This paper was recently it was a very decent paper. It was a moderate paper. Yeah, some topics were repeatedly asked. Some questions from the vasculitis, it was asked 3 questions from the vasculitis, many questions from the Turners. So it was not a balanced looking paper. But yeah, overall the paper was good. Okay, so let me see the questions now. You will help me in reminding the questions. I guess you people are there. Give me a thumbs up. You will help me. Done. So this is the first question. This is the first question. In the first question, I don't know the exact age of the patient. There was a female. In the female, a pap smear is done. A pap smear was done. On the pap smear, they have found certain abnormality. That's why we have done the cervix biopsy. In the cervix biopsy, we find out hyperchromesia, pleomorphism, and involving all layers of the epidermis, involving all layers of the all layers were involved of the mucosal layers, and flattened top. So the options were dysplasia, metaplasia, hyperplasia, and carcinoma in situ and dysplasia. Both were there in the option, or only carcinoma was there? You have to tell me what was the exact question there. So this was the clues given by the students to me. So as I know the correct answer for this question, if carcinoma in situ was there in the option, you have to go for carcinoma in situ, because the hint given in the question, all layers are involved. All layers are involved, but basement membrane is intact. Basement membrane breach is not there. There is a clue in the question. There is a flattened top, and basement membrane is not involved. There is hyperchromasia, there is pleomorphism. It is indicating the cells are abnormal. But if carcinoma in situ is not there in the option, you can go with dysplasia. You can go with dysplasia. So what was there in the exact options? You have to tell me. Exact options में क्या था? Carcinoma था. Okay, only carcinoma. Divya is saying only carcinoma was there. Carcinoma in situ is not there. So question is easy now. So अब question में options में carcinoma in situ नहीं है, सिर्फ carcinoma है. So straightforward, your answer is dysplasia. So Divya, have you marked dysplasia only? It is not metaplasia. It is not hyperplasia. It is not carcinoma. So this question is relatively very easy question. From the first chapter of pathology, we know that is cellular adaptations. We know the 5 type of adaptations. Yes. So atrophy, hyperplasia, hypertrophy, metaplasia, and dysplasia. These are the 5 types of adaptations we know. Hypertrophy is increase in size, hyperplasia is increase in number, atrophy is decrease in size and number, and metaplasia is conversion of one type of epithelia into another type of epithelia, and dysplasia is disordered development. What do you mean by disordered development? You can see the layers. You can see the layers. You can see here the layers. Here, this is the columnar epithelia. The columnar epithelia first get converted into squamous epithelia, and then in the squamous, that is metaplasia. After metaplasia, the cells in the epithelia, all the epithelial layers are involved, and they are becoming abnormal. They are becoming hyperchromatic. They are becoming these features are noticed. So there is disordered arrangement. There is loss of basal polarity. There is pleomorphism. There is hyperchromasia. So in your question, hyperchromasia and pleomorphism, the 2 clues are given. These are the cytological abnormalities seen in the cell. So cytological abnormality is definitely there. Now it is sin. You know, it is sin. It is known as cervical in situ neoplasia. It is known as sin, cervical in situ neoplasia. So these changes are starting from above and coming towards below. You can see here the changes are only in the upper 1/3. Here it is upper 1/3 to 2/3 here, and here full thickness. These changes are there. I am talking about hyperchromasia and pleomorphism. That is dysplastic changes. If it is only in upper 1/3, it is known as sin 1. If it is 1/3 to 2/3 thickness, it is known as sin 2. And if it is complete thickness is there, it is known as sin 3. So it is mild dysplasia, it is moderate dysplasia, it is severe dysplasia. Once these cells, the sin 3 is also known as carcinoma in situ, because full thickness dysplasia is there. Once these cells breach the basement membrane and they come in the stroma, it is not at all carcinoma in situ. It will be known as carcinoma. The question was based on very basics. So the correct answer here is, of course, dysplasia. Done. Done. Okay. So Divya, you are absolutely right. The correct answer for this is dysplasia only. Done. So any other information you want to give in this question, you want to add for your juniors, you are there to recall the questions for you also, for your juniors also. Any extra information given in the question, any other option? I have written these 4 options. These were the 4 options only, or some other option was there in the question? What was the age of the patient? Can you help me with the age of the patient? This is for the benefit of your juniors. Of course, you all will be get selected. I know. I don't want you to repeat my classes here. I wish all of you to get selected and get your dream branch. But what about your juniors? You have to give them a recall, no? A good recall. Anyone among you? What was the age of the patient in this question? Yes? Anyone? Do you know the age? Divya, do you know the age? Or anyone else know the age in this question? Okay, so let me move ahead. Age is not known here. Exact options are not remembering. You are not remembering the exact options. Okay, exact options are there. Okay, Divya saying these were the exact options only. Okay, done. So let me come on the second question. So second question, which is retried by the students, is in front of you. So there was a history. It was a small clinical question. There was a chronic alcoholic is there. So chronic alcoholic is a clue given in the question. Who is having increased abdominal circumference, or hepatomegaly directly given tha ya indirectly, I don't know. Some students told me, ma'am, increase abdominal circumference tha. Some students told me ki ma'am, hepatomegaly directly given tha. I don't know what was given, but of course it was indicating towards hepatomegaly. The size of the liver was increased. Then a liver biopsy is done. Image is not given in the question. Liver biopsy is done. Liver biopsy is showing presence of intracytoplasmic inclusion bodies. What is the composition of that? That is asked in the question. And I don't know about the option. One of the option was cytokeratin. Cytokeratin. Now first you have to give me the diagnosis. So three questions have indirectly asked in this question. First, diagnosis is not given. So you have to tell me what is the exact diagnosis. The patient is alcoholic having a hepatomegaly. So what is the diagnosis here? Number one. Number two, what are these bodies, inclusion bodies? The name of these inclusion bodies. It is not given. Some inclusion bodies are there, but what is the name? And third thing is composition, that is asked in the question. So in the question, directly the composition is asked, but you cannot jump directly to the composition. First, you have to make the diagnosis. Then you have to tell me the name of these inclusion bodies. Then you have to tell me the inclusions. Inclusions. Uh, okay. So yes, what is the diagnosis? Who will tell me the diagnosis on the disease? Patient is chronic alcoholic. Of course, it is towards cirrhosis. It is towards cirrhosis. The three stages of cirrhosis are there. Cirrhosis is the end stage. It is the alcoholic liver disease, you can say. The patient is having ALD, alcoholic liver disease. There are three stages in alcoholic liver disease. Stage 1 is steatosis. Stage 2 is hepatitis. And stage 3 is cirrhosis. So in stage 2, we find these inclusion bodies. What is the name of these inclusion bodies? Can anyone tell me? What is the name of these inclusion bodies? Which the examiner is asking in the question. The name of these inclusion bodies is Mallory Dank bodies, or in some books it is written as Mallory Hyaline bodies. So Mallory Dank bodies or Mallory Hyaline bodies, one and the same thing. So examiner is asking about these bodies. So examiner has given us a clue that patient is chronic alcoholic. There is a hepatomegaly problem with the liver. In the liver, the patient is having alcoholic liver disease. So there is an inclusion body which is present in the cytoplasm, which is, yes, Mallory. Yes, Divya, you are absolutely right. So it is present in the cytoplasm. So of course, we all know these Mallory Dank bodies are made up of cytokeratin. So the correct option here is cytokeratin. Can anyone of you help me with other options? So it is a misfolded cytokeratin. Or in the option, Divya, was it cytokeratin or intermediate filament? Some students are going with cytokeratin, some are saying it was intermediate filament. One of the things should be there in the option, not both, because both of the things are one and the same. तो ऑप्शन में साइटोकेराटिन था या इंटरमीडिएट फिलामेंट था? एक ही बात है, दोनों का मीनिंग एक ही होता है, लेकिन आपके ऑप्शन में क्या था? और बचे हुए थ्री ऑप्शंस कौन बताएगा मुझे? Who will tell me rest of the, although the question is really very easy based on the basics. The first years you study all these things in the first year. In histology and anatomy, in basic histology, you study these things. So this question was from the basic histology, you know. So what were the other three options? So Divya is helping me. So in the question, cytokeratin was there. Intermediate filament was not there. Intermediate filament, cytokeratin is one of the intermediate filament. Yes, but the option contains cytokeratin. What were the other options? Anyone? What were the other three options? There may be four options now. Other three options. So we have to rule out other three options also. So this is the diagram. You can see in alcoholic liver disease, we have three stages. The first stage is steatosis. It is known as fatty liver. The second stage is hepatitis. It is known as steatosis. Steatosis तो पहले ही हो गया है. अब हेपेटाइटिस भी हो गया. So steatohepatitis. And the third stage is the last stage is cirrhosis. It is known as steatofibrosis. Steato तो पहले ही हो गया, अब steatohepatitis हो गया, steatofibrosis हो गया. So these are the three stages. So normal liver, the first two stages are reversible. That I want to show you here in this diagram. You can see the first stage is steatosis. You see the arrows. The arrows are reversible here. The second stage is hepatitis. Again, it is reversible. If the patient quit alcohol, the liver will become normal after some years. But if the patient is not quitting alcohol, continues drinking, then end stage is cirrhosis and it is irreversible. Look at the arrows. It is irreversible. It is unidirectional arrows. So you know there are three stages. This is the diagram of first stage, that is steatosis. It is known as steatosis because multiple microvesicles and macrovesicles are formed inside the hepatocytes. This is a microvesicle. You know, in microvesicle, the nucleus is at the center. See, the nucleus is at the center and the fat globules are in the form of small lobules. It is looking like a floret. It is looking like a flower. So these all are microvesicles. And these are macrovesicles. You see, macrovesicles, the nucleus is pushed to the periphery and single large fatty vesicle is present. So these are macrovesicles. So multiple micro and macrovesicles are there. That's why known as steatosis. Here no Mallory Dank bodies are present. In the second stage, hepatitis, In the second stage, this is the diagram. In the second stage, can you see a intracytoplasmic inclusion inside this pink color, dot, 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 like pink color material present in the cytoplasm? That is cytokeratin. That is cytokeratin. It is present in the cytoplasm. It is a type of inclusion body and it is known as Mallory hyaline or Mallory Dank body. So Mallory hyaline or Mallory Dank bodies are known as alcoholic hyaline bodies. These are intracytoplasmic cytokeratin inclusions that I always give in my notes. These are from my notes only. Yes. So that is the thing you can see here in stage 2. And in stage 3, that is cirrhosis. Finally, grossly you see the hobnail appearance. You see the hobnail. Hobnail, you know, the sole of a foot. The hobnail appearance of the liver, and microscopically you see the lobular pattern is lost and completely it is replaced by nodular pattern. You can see multiple nodules are there, multiple nodules, and which are separated from each other by fibrosis. So this is cirrhosis. This is cirrhosis. And Mallory hyaline bodies are seen not only in alcoholic liver disease. It is the alcoholic liver disease के 3 stages में से second stage में होता है. Apart from it, it is seen in many other diseases also. So for your future exams, you should learn it. So it is seen in primary biliary cirrhosis, PBC. It is also seen in Indian childhood cirrhosis. It is seen in Wilson's disease. It is seen in hepatocellular carcinoma, focal nodular hyperplasia, chronic cholestasis syndrome, and alpha-1 antitrypsin deficiency. So there are 8 diseases in which these Mallory hyaline bodies are seen. Done. Let me move on the next question. So other options Divya told me for this question. Let me write other options for your juniors also. So let me finish this question. So one of the students have helped me with other options. Let me write other options here. So Divya is saying it is actin and microtubules. So we got 3 options. So actin, microtubules, and cytotubules and cytokeratin. Yes. What is the fourth option? What is the fourth option? Anyone with the fourth option? So these were the options given in the question. So answer is straightforward. It is cytokeratin. So together we can make the questions and we can make the correct answer. But together we should do our efforts together. Done. Let me come on the next question. Let me come on the next question. This is the next question in front of you. Please have a look. This is the next question in front of you, everyone. So let me tell you the question first. Then you tell me if there is any modification in the question. If there is any modification in the question. 20-year male was there, or 20-year person, I don't know male or female, I don't know the gender of the person, having benzene exposure. It is not benzidine. Yes or no? Was it benzene or what is benzidine? Because answer will differ. If it is benzene, answer is different. And if it is benzidine, answer is different. Both of them are chemical carcinogens. We have carcinogens, chemical carcinogens. We know carcinogens are of 3 types. Carcinogens are the things which induces carcinoma. So they are physical, they are chemical, they are biological. In biological, they are viruses mostly. They can be bacteria and parasites also. Few bacteria and few parasites are also known which causes cancer, but mainly they are viruses. In chemical, in physical, they are UV and IR light. In chemical, we have 2 types of chemical, direct and indirect. So both of these are chemicals which leads to cancer. Benzene also leads, benzene exposure will lead to cancer also. Benzidine exposure also leads to cancer. So Rajat is saying it was benzene. It was benzene. Divya is also saying it was benzene, and Ravi is telling me the answer, it is bladder cancer. So Ravi, again there is a clinch in the question. If you are saying it is benzene, the answer has to be blood cancer. If it is benzidine, the answer is bladder cancer. That's why I am asking you clearly. I have not given the paper, so don't get confused. If the question contains benzene, the answer has to be blood cancer, especially AML, acute myeloid leukemia. Benzene exposure leads to mutations which leads to AML. We know what is AML. It is a type of blood cancer. And if it is benzidine, the answer is bladder cancer. Now you people will help me only. What is the correct answer here? Whether it is bladder or whether it is whether it is bladder cancer. Here it is given, it is bladder cancer. You can see benzidine, it is a list. Benzidine leads to bladder cancer. Benzidine leads to bladder cancer. So you have to learn this list of carcinogens. So as I have told you, 2 types of carcinogens are there, direct and indirect. This time question is on benzene or benzidine. So question is on benzene. Most of the students told me it was benzene only. Next time question can be on any other carcinogen also. So you should, topics are repeated, not the questions. Remember, always remember, in your next exam you can't expect the same question as it is repeated. Topics are repeated. Now the topic here is carcinogenesis. So carcinogenesis can be physical, can be chemical, can be biological. So you have to learn all carcinogenesis, which carcinogen leading to which cancer. So the list is important for you. So anytime the question can come from this list. So another question can be framed from this list. Done here. So this is the list for chemicals and this is the list for biological. In the biological, you can see these are the bacteria. These are the bacteria. Some of them are DNA bacteria, some of them are RNA bacteria. Only one, these are the list of viruses. Only one bacteria leading to cancer. Only one bacteria is a carcinogen, which is H. pylori. This is a bacteria. These are the viruses and these are the parasites. So 4 parasites. So six viruses, 1 bacteria and 4 parasites. I'm not reading the names as you already know the names, but anytime question can come from this. So for you also, but I expect you shouldn't give the exam again. I'm wishing best of luck to all of you. But for your juniors, question can be framed anytime from this list. So you should know all the name of the viruses, which virus leading to which cancer. Name it, name it. Which bacteria is leading to which cancer. Which parasite is leading to which cancer. So this is a biological carcinogenesis. In the same way, this is chemical carcinogenesis. So which chemical is leading to which cancer. Learn the name of the chemicals also. Learn the name of the cancers also. I'm not reading the whole list. It will be exhaustive and it will take most of our time from the lecture. Currently, my motto is a first glance. I want to come with the more options. So what were the options there? So Rajat, Divya, Ravi, anyone else? What were other options? What were the other options? These 2 options are confirmed. I'm sure with bladder cancer and blood cancer. But the other 2 options were lung and liver only. Lung and liver only. Yes or no? Tell me what were the other 2 options. And in the question, how many of you are with benzene? Question contains benzene only, no? It is not benzidine. You are sure enough. Yes or no? You are sure enough. It is not benzidine. It is benzene. So yes, most of the students told me the question contains benzene only and option contains blood cancer. So answer is AML. So remember again, I am telling you this information is based on the answers are based on the information given by the students only. If some additional information is there, you can tell me that information. We can change, the answer can be changed accordingly. So there is this is a disclaimer, yes or no. So I will come with a more detailed analysis once I'm getting constantly getting messages from all the students regarding these questions. So once I will come up with 100% information given in your paper, then I will take a detailed analysis 2-3 days later. So wait for that. Till then, there is one more information given in the question, as most of the students told me: fatigue, weakness, and multiple infection. Was it? Was it, Divya? Fatigue, weakness, or multiple infection tha kya? Because if it is present, again it is indicating towards blood cancer. In blood cancers, in AML, in leukemias, we have anemia. So because of anemia, patient is presenting with fatigue and weakness. Yes, because of fatigue and weakness is representing anemia. तो anemia bladder cancer में क्यों होगा? Unless until patient is presenting maybe hematuria. ब्लैडर कैंसर में हिमैचुरिया की वजह से अनीमिया हो सकता है, ब्लड कैंसर में ज्यादा कॉमन है ना फटीग और वीकनेस होना. ओके चलो, फटीग और वीकनेस दोनों में हो सकता है. व्हाट अबाउट मल्टीपल इन्फेक्शंस? मल्टीपल इन्फेक्शंस ब्लड कैंसर में ही होंगे ना. इन पेशेंट विथ AML, patient is having leukocytosis. WBC count is abnormally increased in lakhs, but all the WBCs are immature, or you can say these are blast only. So these are not mature normal WBC. So that's why patient presents with multiple infection again in AML or blood cancer, not in bladder cancer. But I'm not sure whether this information given in the question or not. Fatigue दिया था क्या, multiple infection दिया था क्या, और benzene दिया था क्या? अगर ये 3 चीज question में confirm था, that is benzene, that is fatigue, weakness, and multiple infection. So answer is sure enough, it is bladder cancer, whatever is the age of the patient. Done? Should I proceed? So Divya is saying yes, Rajat is also saying yes. And same options were there. Divya is saying other two options are same. So rule out other 2 options also. Lung cancer का chemical क्या है और liver का क्या है? Liver cancer का chemical is aflatoxin. These leads to liver cancer. Or lung cancer का there are multiple, you can see. So there are different chemicals which are leading to lung and liver cancer. So that was the whole thing given in this question. What I can summarize till now. So let me move on to another question. Another question, it is in front of you. Next question: poor prognostic factor for multiple myeloma. I came up only with 3 options. Is were the options? One of the option was raised beta 2 microglobulin. Raised beta 2 microglobulin. Second option, one of the option was hypercalcemia, raised level of calcium in the blood, and increased creat. Was there an option of increased creatinine? And what was the 4th option? I want to ask you. What was the 4th option? And what is the correct answer you people have marked in this? What is the correct answer you people have marked in it? Anyone among you want to tell me the correct answer? What is the correct answer? Yes, of course. Yes, you are right. The correct answer here is raised beta 2 microglobulin. So here I would like to tell you international staging system, or rather I will say revised international staging system for the multiple myeloma. These are the criteria in which we include the staging of multiple myeloma. Multiple myeloma stage 1 है कि stage 2 है कि stage 3 है, depends on these criteria. So stage 3 में क्या क्या आ रहा है? Let me tell you. Stage 3 में beta 2 microglobulin का value more than 5.5, or if there is a abnormality, chromosomal abnormality detected by fish, or high LDH. So we are taking three criteria: fish में chromosomal abnormality, beta 2 microglobulin, and high LDH. These three are indicating stage 3. Stage 3 multiple myeloma, stage 3 have poor prognosis. So these three are poor prognostic. Among these three, option contains beta 2 microglobulin. That's why I will go with beta 2 microglobulin. Although I must add here something: increased level of calcium, and increased creatinine. In multiple myeloma, kidney failure is there, renal failure is there, and because of renal failure we have increased creatinine level. So these two are also poor prognostic factor. These two are also indicating patient is having multiple myeloma. But to select among the options, the best is beta 2 microglobulin. अगर इसकी जगह fish होता ना option में, चौथा option was fish, chromosomal abnormality by fish, I will go with that. तो बेस्ट होता है क्रोमोसोमल एब्नॉर्मलिटी आप डिटेक्ट कर लो फिश से. वो नहीं कर पा रहे हैं तो ब्लड में क्या करोगे? ब्लड में तीन ऑप्शन है मेरे पास. Either in the blood I will see beta 2 microglobulin, or in the blood I will see calcium level. But calcium level is non-specific ना, दूसरे diseases में भी हो सकता है. Creatinine is also non-specific. Beta 2 microglobulin is towards more specificity, leading to multiple myeloma, and it is a poor prognostic factor. Give me a thumbs up if you got it. Give me a thumbs up. Increased protein. Divya is saying the fourth option is increased protein. Increased protein in the blood. Yes. So yes, the correct answer here is beta 2 microglobulin. Have you marked that only, Divya? Yes. So the correct answer here is beta 2 microglobulin. Done. So this is the next question in front of you. I will be a little bit fast. This is the next question in front of you. Please read the question. Read the question. A 50-year-old male is there having dragging sensation in the abdomen, having massive splenomegaly, having anemia, having eosinophilia, having basophilia, and AMI ratio, myeloid erythroid ratio was raised. Maybe it was 18:1. Some student told me, some was saying it was, exact number is not known. But yeah, AMI ratio is raised. AMI ratio is certainly raised. So what is your diagnosis? What is your diagnosis, and how you will confirm your diagnosis? What is the most best test to confirm your diagnosis? First tell me the diagnosis ना. What is the diagnosis? What is the diagnosis? Diagnosis क्या है वो बताओ. Diagnosis पता होगा तो उसके लिए best test we will conclude. So of course, see the age of the patient, see the symptoms. Patient is having splenomegaly, anemia, eosinophilia, and basophilia, and AMI ratio is raised. So, but of course, the diagnosis is CML, nothing else than CML. So, it is chronic myeloid leukemia, depending on the clinical scenario given in the question. So, in CML, we know there is 922 translocation. There is 922 translocation is there. And for confirming 922 translocation, we do FISH or PCR. We also do lab score. I agree, lab score. That is leukocyte alkaline phosphate. That is lab. It is the enzyme which is present inside the leukocyte. So leukocyte is WBC. We know here the count of WBC is raised. It is nearly 1 lakh to 2 lakh in CML. So that's why WBCs are increasing. So lab score is also increasing, of course. But we do lab score to differentiate CML from leukemoid reaction. And lab score is more increased in leukemoid reaction as compared to CML. So lab score is only beneficial if you want to differentiate the two. If you want to confirm the diagnosis of CML, there is no need to do lab score. Practically, we don't do lab score. We directly order FISH or PCR if we suspect CML in any adult 50-year-old male is coming to your clinic with a massive splenomegaly. Splenomegaly is already indicating patient is having some disease, and you have done a CBC. In CBC, you found anemia. Eosinophilia is also indicating towards it. Basophilia is also indicating towards it. The AMI ratio is drastically increased. You know, AMI ratio is increased, so it has to be some myeloid malignancy. So myeloid malignancy, the best fitting with the age and the clinical scenario is CML. It is the CML. And to confirm CML, the best test to be done here is FISH. You know, it is FISH fluorescent in situ hybridization, or PCR. So both are molecular techniques. So molecular techniques में exact हमें translocation दिख जाएगा तो और बचा क्या? So 922 translocation मिल गया. With this clinical scenario, the only diagnosis is CML. It is confirmed. The only drawback of this test, it is costly. It is costly. But if the patient can afford, best to go with FISH and PCR. Done or no? Done or not? No, no, Rajat. Not flow cytometry. We don't do flow cytometry in CML. Unfortunately, we don't do it in CML. CML में हम FISH prefer करेंगे, flow cytometry नहीं करेंगे. Anyone else? Immunophenotyping, no, immunophenotyping is an option, Ravi. Immunophenotyping में you do CD markers. So you will do CD markers, लेकिन directly तुम्हारे पास option है exact mutation देखने का. तो फिर immunophenotyping के लिए क्यों जाओगे? Immunophenotyping में we use various ISCs and we do various markers, CD markers for it. So CML में blast are increased, so CD34 will be there depending on the blast crisis की कौन से इसमें है. लेकिन exact कोई ISC marker नहीं है जो CML को differentiate करेगा. तो exact करने के लिए we will go only with FISH or PCR. Only two molecular techniques are there. So the correct answer, no doubt here, it has to be FISH. Any other information given in the question you want to add here? Those who have given the paper, I'm requesting you. If any other information given apart from it, that will add something to the question and that will help your juniors. So come up with the information. Any other information, or the option was different, some different option was there, or it was exactly same? You have to help me, yes or not? You have to help me. So CML, in CML, patient comes with leukocytosis, with granulocytic immaturities. Patient comes with basophilia. Patient comes with splenomegaly, and patient will have Philadelphia chromosomal abnormality. These are the four things which are present, four criteria to diagnose a case of CML. So in our question, leukocytosis is already there, basophilia is already there, massive splenomegaly is already there. To confirm CML, you have to do FISH. To confirm Philadelphia chromosome. Now, what is Philadelphia chromosome? You know how WBCs are formed. I will give you only a brief review in 1 minute. I will not teach you entire CML. Yes, you already know it. So you know how neutrophil is synthesized. So this is from the blast. This is the myeloblast. This is myeloblast present in the bone marrow. Myeloblast से बनेगा promyelocyte, myelocyte, metamyelocyte, band form, then neutrophil. So how it is formed? So this is the bone marrow. Inside the bone marrow, the first cell is hematopoietic stem cell. Hematopoietic stem cell से बनेगा myeloblast. Myeloblast से बनेगा promyelocyte, myelocyte, metamyelocyte, band form, and then neutrophil. So this is the precursors of neutrophil, and ultimately this neutrophil will come in the blood. So this is how neutrophil is formed, and it will come. It is a multilobated cell, and it is coming in the blood. So in the blood, listen, in the blood we only found neutrophil. We do not found these cells in the blood. We do not found myeloblast, promyelocyte, myelocyte, metamyelocyte, and band form in the blood normally. But what is happening in this cell, in myeloblast का जो nucleus है, उसके अंदर there are 46 chromosomes, 23 pairs of chromosomes in all cells. So this myeloblast also, these cells also contains all of these precursors, contains the 46 chromosome. So उसमें pair number 9 और pair number 22 में exchange हुआ, that is ABL BCR exchange, जिसकी वजह से mutation हुआ इनमें, जिसकी वजह से these cell proliferate uncontrolled mitosis हुआ, और इतना mitosis हुआ कि they just flooded the whole bone marrow. तो बाकी erythroid series और platelet की series गायब हो गई, and they just replace the whole bone marrow, and they all will come in the blood. So in the blood you are finding the immature precursors of the neutrophil. So normal WBC count आपका होता है 4000 to 11000. यहाँ पे आपको मिलेगा nearly 1 lakh to 2 lakh count. So all the cells are immature, but so WBCs बहुत है, लेकिन सारे के सारे immature हैं. So that is the problem here. That is the problem. So that is known as 922 translocation. You can see this is pair number 9. See, this is pair number 9. This is pair number 22. On pair number 9, ABL is present. Can you see? On pair number 22, BCR is present. Can you see? So what is happening? Pair number 9 is giving ABL portion to pair number 22. 22 पे BCR तो पहले से ही था. ABL भी पहुंच गया, तो ABL BCR फ्यूजन बन गया, और जिसकी वजह से अनकंट्रोल्ड माइटोसिस हुआ. इस अनकंट्रोल्ड माइटोसिस की वजह से it is leading to CML. So in fish or in PCR we will detect this abnormality. तो exact अगर ये fusion gene मिल गया fish पे या PCR पे, तो what is else? The diagnosis certainly nothing else than CML. So best to go is with fish and PCR only. Lab score is indicating, but it is not a confirmatory. It only differentiated from leukemia reaction. Give me a thumbs up. Give me a thumbs up if you got it. Give me a thumbs up if you got it. Should I proceed ahead? There are 3 phases in CML depending on the blast. CAB. Chronic phase, accelerated phase, blast phase. So depending, your blast, myeloblast less than 10%, 10 to 20%, or more than 20%. Depending on the blast, how many blasts are present in the blood. There are 3 phases. Unfortunately, हमारे question में blast का number or percentage is not given, so we cannot commit the phase of the CML. But it is CML. It is CML. So let me move to the next question. Are you people there? Give me a thumbs up. So have you marked it correctly? Yes or not? Have you marked fish or not? For this question, the correct answer, up to this information, the correct answer here is fish. So this is the next question in front of you. So there was a question Who will tell me? Rajat, will you tell me? Divya, will you tell me? So there was a question on HNPCC, hereditary non-polyposis colonic cancer. You know the full form of HNPCC, of course. So hereditary non-polyposis colonic cancer. What is the defect in it? What is the chromosomal defect? What is the chromosomal defect for this malignancy? It is a type of familial cancer, you know. What is the defect? Anyone tell me? A straightforward question. I don't know the options. I don't know about the option. But what is the correct answer? We know it is a one-liner. It is a straightforward question. So mismatch. The correct answer is mismatch DNA repair. Mismatch DNA repair. That is mutated. That is the correct answer here. Was it there in the options, Divya? Was it there? Anyone among the audience? Was it there in the options? Mismatch DNA repair. So the correct answer here is mismatch DNA repair. Most of the students told me, ma'am, yes, this was the option there, and this is the correct answer, of course. If it was the option, you know, in HNPCC there are two types of chromosomal defect. One is APC gene, which is present on chromosome 5, and second is microsomal instability, MIS, which is this mismatch DNA repair. So two type of chromosomal abnormalities. Among them, MIS is given in the option. Give me a thumbs up if it was a question. And who will help me for rest of the three options? Among the audience, can someone help me with rest of the three options? Rest of the three options क्या थे? कोई help करना चाहेगा? बाकी abnormalities क्या दिया था? So we will rule out कि वो किस किस malignancy में होती है. It is not HNPCC, तो कुछ और malignancies होंगी. So we have to rule out other options also. The correct answer here is mismatch DNA repair, which was there in the option. So was it there in the option? Yes. Who will tell me? Just a second. Yes. So should I proceed ahead? Should I proceed? So this is the next question in front of you. So this is the next question. Crumpled paper appearance. Was the image given in the question? Was the image given in the question? Crumpled paper appearance. So this is a typical again one-liner. One-liner. We teach students these one-liners. So again, crumpled paper appearance. You can see wrinkled. You can see crumpled or wrinkled, one and the same thing. Wrinkled, what was given in the question, I don't know, but one and the same thing. So if you take a tissue paper and you just wrinkle it, and you just again open it, so how does it will look? It will have these wrinkles over it. So can you see the wrinkles? So crumpled, wrinkled appearance of the cell is typically seen in Gaucher disease. We know it is a storage disease. It is Gaucher disease, and it is due to the defect glucocerebrosidase. So glucocerebrosidase accumulation is there. So in the question, I guess glucocerebrosidase has to be asked. So your option, one of the option contains glucocerebrosidase. Again, it is a one-liner. I don't know about the rest three options, but the correct option may be here. Most probably it is glucocerebrosidase. Crumpled paper appearance, Gaucher is not given in the question. So from crumpled or wrinkled paper appearance, you have to come on the diagnosis first. So it is Gaucher, and from Gaucher you have to come to the what is accumulated in the Gaucher, which is giving this crumpled paper appearance. So it is glucocerebrosidase. Give me a thumbs up. Was it there? Was it there? Who will tell me? Just let me see if I can see your chat. Okay, okay, I can see your chat. Okay, so let me move ahead. So that was Gaucher disease pe jo question tha. This is the next question in front of you. So let me read the question. A young female was there in the question, having three complaints. Number one, she was having migratory arthritis. So she was having pain in the large joints, maybe in the shoulder, maybe in the knee. What was given in the question, I don't know. So patient was having migratory polyarthritis. Migratory polyarthritis is there. Pansystolic murmur is there. Patient is having pansystolic. If you have auscultated the patient, patient is having pansystolic murmur. You have immediately ordered an echo of the patient. On the echo, you found mitral regurgitation. MR is there. So typical clinical scenario. So two things are there: migratory arthritis and pansystolic murmur. So there is valvular deformity. Valvular deformity, mitral wall is involved, and in mitral wall there is mitral regurgitation. So typical scenario, yes, you are right, Rajat. So it is showing typical scenario. It is RHD, rheumatic heart disease is there. Now this image is given. Rajat, is this image, it was given in the question or some similar image given in the question? So your biopsy is done, and this is the biopsy. You have to say what the typical finding in this biopsy. So one of the option, yes, it is a biopsy from the myocardium. In the myocardium, you can see these are myocardial cells. ये पूरे आसपास जो cells हैं, ये पूरे myocardial cells हैं. So this circle is some abnormality. I have made this circle. No, this is some abnormality. So it is showing a giant cell. Here, giant cells I can find. I can find a necrosis at the center. This is necrosis at the center. So it is a granuloma. This granuloma in the RHD is Ashkoff nodule. So it is a typical picture of Ashkoff Ashkoff nodule. So the answer is Ashkoff body or Ashkoff nodule, whatever given in your options. So answer here is Ashkoff nodule. Typical diagram of Ashkoff nodule is given. In Ashkoff nodule, we find two types of cells, that is Ashkoff cells and anti-Ashkoff cells. Ashkoff cells are giant cells. These are the giant cells. And anti-Ashkoff cells are caterpillar. Can you see here? This is the cell. A caterpillar or owl-eye appearance cell. So the nucleus shape is caterpillar or owl-eye appearance. So that is the diagram of Ashkoff nodule, which is the type of granuloma. That is the pathogmatic granuloma. So that is the pathogmatic feature of rheumatic heart disease. So we know in rheumatic fever, what is the problem? This is a child. It usually occurs in child. This is the child. Child is having pharyngitis. The tonsils are involved. By group A beta streptococcus pharyngitis. Can you see the tonsils? Can you see the bacteria inside the tonsils? So body is forming antibodies against the bacteria. So what is the problem? These antibodies will kill the bacteria. Okay. But these antibodies are autoantibodies. Actually, the antigen which is present over this bacteria, the antigen which is present over the bacteria, the similar antigen, that is M protein. Similar antigen is present on 5 human organs: heart, brain, skin, subcutaneous tissue, and joint. Can you see? This is the antigen drawn here. So it is similar as that of bacteria, that is M protein. So these antibody will get confused. They will kill the bacteria, but they will bind with the 5 organs of the body. That is autoimmunity. So 5 diseases and 5 organs. What are the 5 diseases? In heart, there is rheumatic heart disease. In brain, there is syndrome scoria. In skin, there is erythema marginatum. In subcutaneous tissue, there is subcutaneous nodules. And in joints, there is migratory polyarthritis. These are the 5 major Jones criteria. So patient can come any of them. So in our question, the patient is coming to us with 2 of them. Number 1, migratory polyarthritis is given in the question. And rheumatic heart disease, patient is having mitral regurgitation की वजह से pansystolic murmur. So 2 out of these 5, 2 are present in our question. So patient is having rheumatic fever. Our patient is having rheumatic fever. So that is the thing. So rheumatic fever is the umbrella term which contains 5 different diseases. Say yes or no, which contains 5 different diseases. So let me tell you, that is molecular mimicry. Jones major criteria. You can see Jones major criteria. These are the tonsillitis. After tonsillitis, patient is presenting with these 5 complaints. Done. So I'm not going in detail. Let me tell you something. Let me tell you something about this heart, rheumatic heart disease. In rheumatic heart disease, there are 3 layers in the heart: endocardium, myocardium, pericardium. All 3 layers are involved. Endocarditis, myocarditis, pericarditis. That's why it is known as pancarditis. Pan means all. Pancarditis. So patient is presenting with pancarditis. All the layers are involved. Pancarditis. You can see the 3 layers. All 3 layers are involved here. Patient is presenting with pancarditis. Let me tell you, these are the 3 layers. You can see the red one is endocardium, the black one is myocardium, the green one is pericardium. The 3 layers are there. And these are the balls. Balls are also made up of endocardium and rest of the endocardium. So the endocardium which is present over the walls is known as valvular endocardium, and rest of the endocardium is known as mural endocardium. Done. So what is actually happening? This is happening. This is the scenario: pancarditis and rheumatic fever. So in endocarditis, the 2 types of endocardium, valvular and mural, myocardium and pericardium. Let me tell you something. So valvular endocardium, vegetations are formed. Vegetations are multiple, small. You can see these are the vegetations. These are the vegetations. So these are the most common ball involved is mitral. So here in mitral also there are 2 possibilities: mitral regurgitation and mitral stenosis. Both can happen, but regurgitation is more common than stenosis, and because of both of them there is murmur. Because mitral regurgitation is there is pansystolic murmur, so which is given in our question. So that is happening because of vegetation. So most common wall involved is mitral, followed by aortic, followed by tricuspid, followed by pulmonary. So least common is pulmonary, and most common abnormality which is given in our question also, it is mitral regurgitation, which is leading to pansystolic murmur in our question. So that is the clue given in our question. So it is giving a typically fish mouth appearance or buttonhole appearance. Fish mouth or buttonhole. Done. These are the vegetations. After vegetation on the mural endocardium, you will find a wrinkled area that is known as McCallum patch, especially in the left atrium. So endocardium is over. In the endocardium, you can see in the walls there is vegetation, and in the mural endocardium there is McCallum patch in the left atria. Coming on myocardium, there are Ashkoff bodies formed in the myocardium. Can you see? This is the myocardium. This is the myocardium. In the myocardium, multiple Ashkoff bodies are formed. What are these Ashkoff bodies? These are granulomas. Let me zoom one of the Ashkoff body for you. So let me zoom one of the Ashkoff body for you. You can see this is one of the Ashkoff body. In the center, you can see a yellow colored thing. This is fibrinoid necrosis. In the center, there is fibrinoid necrosis surrounded by two types of cells. You can see one of them is giant cell. This is a giant cell. This is Ashkoff cell, the red one. And the second green one, you can see the green colored cells. The green colored cells, some of them are caterpillar shaped and some of them are owl appearance. So if I see samne se, so it will be owl, and if I see transversely, it will be caterpillar. So it is the same cell looking with two different. So this is anti-Ashkoff cells. So two types of cells. This is the diagram given. So you can see the fibrinoid necrosis in the center, a giant cell here, that is the Ashkoff cell, and this one you can see owl eye appearance and caterpillar appearance. This is anti-Ashkoff cell. Both Ashkoff and anti-Ashkoff cells are macrophages, modified macrophages. One of them is giant, that is Ashkoff, and one of them is caterpillar and owl eye appearance, that is anti-Ashkoff. Maybe I'm sure in your diagram both the cells are shown. Yes, whether both the cells are shown, yes or no? So this is the diagram given to you in your exam, right? Or this is the diagram maybe. So typical diagram is given to you in your exam. Done. And in pericarditis, there is bread and butter appearance, that is fibrinous pericarditis. That is the summary. That is the summary. Let me move to the another question. बहुत detail हो गई इसकी. Let me move to another question. So anything else you want to add here? Anything else you want to add here? Yes. So this is the next question. So it was a very simple question. The most simple question in the paper. There was a child. So clue is there. The age of the child. So child was there. Was the age given? Was the age given with a rosettes? Which rosettes? Flagner, Winter Steiner. You know the type of rosettes. So it is FW. That is Flagner, Winter Steiner rosettes. So what is the diagnosis? Of course, straightforward question, straightforward answer. I'm not interested in the option. One of the option is retinoblastoma and that is my answer. I'm not interested in rather three options because it is a straightforward question. कुछ confusion नहीं है. कुछ भी confusion नहीं है. ये rosettes आपको सिर्फ और सिर्फ retinoblastoma में ही मिलेंगे. If specific name is asked in the question, specific has to be answered. Give me a thumbs up. Have you marked that? So these are the rosettes you can see. You can see these are Flagner, Winter Steiner rosettes you can see. The tumor cells are arranged in the form of the circles. So what are the types of the rosettes? If the lumen is, and you know, in all rosettes, tumor cells will form a circle. Circle means rosette. So tumor cells are forming a circle and central space is empty. The central space is empty. It is known as ependymal rosette. It is known as ependymal rosette. It is seen in ependymoma. It is seen in ependymoma. If the tumor cells are arranged around a blood vessel, can you see a blood vessel at the center? And tumor cells are arranging around the blood vessel. So it is known as perivascular rosette. Perivascular rosette. Perivascular rosette is seen in some of the tumors. That is perivascular rosette. You can see here Flagner Winter Steiner rosette, which is our question. So Flagner Winter Steiner rosette. So here are the tumor cells. These are the tumor cells, and tumor cells are sending short cytoplasmic processes in the lumen. Can you see this light pink color? If you zoom it out, you can appreciate this light pink color processes. So tumor cells are sending processes in the lumen, short cytoplasmic processes. So that is seen typically in retinoblastoma. And last is Homer Wright rosettes. In Homer Wright rosette, in the center, neuropil is filled. So tumor cells are arranged in the form of a circle, and in the center, a pink colored acellular material is filled, that is known as neuropil, and it is typically seen in neuroblastoma. So retinoblastoma में आपके Flagner Winter Steiner मिलेंगे, neuroblastoma में आपके Homer Wright मिलेंगे. So that is the basics about the rosettes, you know. So question में आपका typical Flagner Winter Steiner लिखा हुआ था. Image is not given. Students told me image is not given in the question, right? Is the image given? Ravi, was the image given? Divya, was the image given? Or image is not given? Straightforward question was there. Image अगर देके पूछते तो question was little bit tough. But here image is not given. आपको क्वेश्चन में आइडेंटिफाई करना पड़ता कि रोजेट कौन सा वाला टाइप है, इमेज होता तो. लेकिन यहाँ पे इमेज नहीं दिया था आपको क्वेश्चन में. आप लोगों को क्वेश्चन में डायरेक्ट नाम लिख के दिया था, फ्लैक्सर विंटर स्टीनर रोजेट किस में होते हैं. इमेज इज नॉट गिवन टू यू. So the correct answer here is straightforward. Yes, no image, Divya. You are right. Most of the students told me this only. Image was not there. It was a straightforward. Divya, what were the other three options? Maybe neuroblastoma होगा एक option. And child with white eye. Okay, white eye reflex अगर था तो और क्या है? White eye reflex, white eye leukoplakia. You know white eye reflex is leukoplakia. So आपको ये भी क्वेश्चन में है तो additional finding है. So your diagnosis is straightforward, confirm it is a case of retinoblastoma, nothing else. Done. So you should know the other type of rosettes also for your future exams. Yes, इस बार इस पे आ गया तो next बार इस पे किसी पे भी आ सकता है. So you should know the image of each type of rosette. What is the difference between them? Submit tumor cells are arranged in the circular pattern, but what is present in the lumen that is making a difference? Is the lumen empty? Is the lumen contain a blood vessel? Is the lumen contain the cytoplasmic process, or is the lumen contain neuropil? So that is the basis of these 4 types of rosette, and you should learn the example of each of them for your future exams. Done. Should I proceed to the next question? Should I proceed to the next question? This is the next question in front of you. Again, a straightforward question. Straightforward question, straightforward diagnosis. 65-year-old male with mediastinal mass, and patient is showing PERCA, that is pure red cell aplasia. Does any other information given to you in this question, Divya? Any other information? The options were 3 options I am knowing. Thymoma, non-Hodgkin's lymphoma, bronchogenic carcinoma. What was the 4th option? You have to tell me, and what is your approach? What is the correct answer here? But of course, all of us know the correct answer here is thymoma only. So if only mediastinal mass is given, mediastinal, this is the differential for mediastinal mass. So in the question, Divya, maybe anterior likha hoga. Anterior tha ki nahi tha? If any mediastinal mass is given to you, its location is given, usually given in the question. Maybe आपके question में है कि नहीं, I don't know. But anterior mediastinum की middle mediastinum की posterior mediastinum mass कहाँ पे है? So on CT scan, you will see the exact location of the mediastinal mass, and these are the differentials considered accordingly. So maybe जहां तक मेरा prediction कहता है, सिर्फ mediastinal mass नहीं होगा, maybe anterior mediastinal mass होगा. नहीं भी होगा anterior mediastinal mass, तो भी आंसर हम बना लेंगे, don't worry. So anterior mediastinum में these are the differentials. Maybe a thymus. Thymus is present in the anterior mediastinum. So thymoma or thymic carcinoma. Thymoma and thymic carcinoma both are lesions in the thymus, or thymolipoma or thymic cyst. So these are the 4 lesions in thymus. You know, thymus gland is there. So thymoma, thymic carcinoma, thymolipoma or thymic cyst. Hodgkin's lymphoma, non-Hodgkin's lymphoma both can occur. Germ cell tumors, especially teratomas, if the young, it is not a young, ये 65 में कभी germ cell tumor नहीं होगा. 25 की एज होगी तो मेरा पहला differential germ cell tumor जाएगा. यहाँ पे 65 में germ cell नहीं होगा. और thyroid substernal goiter. Sometimes thyroid, maybe usually thyroid आपका mediastinum में नहीं होता, but sometimes it is placed inappropriately and goiter can be there. वहां पे जा सकता है. Middle अगर है तो it can be esophagus tumor, it can be parathyroid adenoma, it can be bronchogenic cyst. Esophagus का cyst हो सकता है. Posterior है तो you have only 2 differentials, either it is neurogenic tumor और neuroendocrine tumor. तो पहले मुझे ये बताओ क्वेश्चन में anterior था कि नहीं था. यदि नहीं भी था तो चलो अब ये सारे differentials लेने पड़ेंगे. मैम क्वेश्चन में anterior नहीं था, सिर्फ mediastinal mass है, तो how would we know कि anterior है कि middle है कि posterior है? Okay, no problem. There is one more clue given in the question, which is a big clue. Patient is having PERCA, pure red cell aplasia. Diagnosis is nothing else than thymoma. In thymoma, PERCA occurs as a paraneoplastic syndrome. Paraneoplastic syndrome. You know what is paraneoplastic syndrome? The tumor cells secrete some proteins or some molecules in the blood, which is leading to symptoms which are not related to the tumor. So patient is presenting with severe anemia. So that is the complaint of the patient. Patient ये mass patient को कुछ दिक्कत नहीं दे रहा है. Patient is unaware कि मेरे अंदर कोई mass है mediastinum में. Patient को severe anemia हो गया. So PERCA is the problem with the patient. So when you investigate PERCA के लिए तुमने एक abdominal chest CT किया, you will find a mediastinal mass because the two things are associated together. Thymoma leads to as a part of paraneoplastic syndrome there is PERCA. One more thing as a part of paraneoplastic syndrome in thymoma. Can anyone of you tell me? Maybe that is not given to you in the history. That is myasthenia gravis. तो यूजुअली इस क्वेश्चन में myasthenia gravis इस तरह के क्वेश्चंस में ये भी हिस्ट्री में होता है, लेकिन तुम्हारे क्वेश्चन में नहीं है. So myasthenia gravis, PERCA, thymoma, these 3 things are associated. So the correct answer here is thymoma. PERCA is the clinch in the question given. Give me a thumbs up, Divya. Have you marked it correctly? Yes or not? Rajat, have you marked it as thymoma or something else you have marked it? So thymoma, it was a very simple question. Most of the students have marked it correctly. I know it. So this is the next question in front of you. It was a difficult question. It was difficult. I agree it was a difficult question. So 18-year-old male, I'm not sure about the age, but most of the students told me it was a young male. So 18-year-old male with recurrent infection and bleeding gums. Recurrent infection means WBC. WBC is less, and recurrent bleeding gums means platelet is less. Platelet is less. So patient is having less platelet, less WBC. On investigation found to have pancytopenia. तो लो RBC भी कम हो गया. So all 3 lineage, all 3 series, all 3 lineage RBC, WBC and platelet are less. So patient is presenting with pancytopenia. It is given in the question. Question में pancytopenia है, ये तो आपको दिया ही है. You have done a peripheral smear. In the peripheral smear, you found out macrocytes and low retic count. On bone marrow, there are no megakaryocytes. It is a big history. There are no megakaryocytes on the bone marrow. So patient is presenting with pancytopenia. सो व्हेनेवर एनी पेशेंट, अगर पैनसाइटोपिनिया है तो इनमें से एक ऑप्शन हटा दो जिसमें पैनसाइटोपिनिया नहीं हो सकता. कौन सा ऑप्शन रूल आउट करोगे? यू हैव टू रूल आउट आईटीपी. इन आईटीपी देयर इज नो पैनसाइटोपिनिया. रेस्ट ऑफ द थ्री ऑप्शंस कैन हैव पैनसाइटोपिनिया. वर द करेक्ट ऑप्शंस. ऑप्शंस ठीक है, यही ऑप्शंस होंगे आपके एग्जाम में भी. I guess you have these options only: MDS, aplastic anemia, and PNH. Yes or no? So MDS, aplastic anemia, and PNH, all of them can present with pancytopenia. If any question to you coming in your exam with pancytopenia, you have to see for three things: whether it is hypocellular marrow or hypercellular. Pancytopenia is a finding on peripheral smear. On CBC you found it is pancytopenia. RBC भी कम है, WBC भी कम है, प्लेटलेट भी कम है, तो बोन मैरो करो ना. बोन मैरो हाइपोसेल्युलर है कि हाइपर है, और बोन मैरो इन्फिल्ट्रेशन है, उसके बेसिस पे डायग्नोसिस बनाओ. Pancytopenia में three types of differentials are there. So always you have to look at the bone marrow. In your bone marrow, there are no megakaryocytes. That is, your bone marrow is hypocellular. So pancytopenia, my diagnosis is going towards pancytopenia with a hypocellular marrow. So my answer here is aplastic anemia. Whether it is primary and inherited or whether it is secondary. कोई सा भी aplastic anemia हो, so my answer here is aplastic anemia. MDS में भी पैनसाइटोपिनिया होगा, PNH में भी पैनसाइटोपिनिया होगा, लेकिन बोन मैरो हाइपरसेलुलर होगा. यू कैन सी MDS हियर, PNH हियर. सो वहां पे बोन मैरो हाइपरसेलुलर होगा, हाइपोसेलुलर नहीं होगा. गिव मी अ थम्स अप इफ यू गॉट इट. सो दैट इज द अप्रोच फॉर दिस क्वेश्चन. सो नॉट ओनली फॉर दिस क्वेश्चन, पैनसाइटोपिनिया पे योर एग्जाम में कोई भी क्वेश्चन आए, योर अप्रोच शुड बी लुक एट द बोन मैरो. Bone marrow is hypocellular or hypercellular. Depending on that, you will make your diagnosis from the given options and given clinical scenario. Give me a thumbs up. So the correct answer, as the history told to me by the students, the correct answer up to this history is aplastic anemia. Are you agree with me? Those who are listening, are you agree with me? Should I move to the next question? This is the next question in front of you. Was it a question? A lung was given in your question. I don't know the exact clinical scenario, but there was a black nodule at the hilum of the lung, or hilum lymph node was showing a black nodule. So the correct answer, it was a straightforward question. The correct answer here is definitely anthroposis. It is a type of pneumoconiosis. It is a type of pneumoconiosis, you know. So it is a type of pneumoconiosis in which black color pigment is deposited in the lung and giving this black appearance. That was a straightforward question. I guess the answer is also correct. Most of you are right. Again, a tricky question, a difficult one, you can say. A moderate difficult one was this one. A young patient or middle-aged patient was there. I don't know the sex of the patient, gender of the patient, whether it's the male or female, presenting with fatigue tiredness. So fatigue tiredness means patient is having anemia and lymphoadenopathy. Multiple lymph nodes are involved. A lymph node biopsy is done. So this question was based on IHC profile. So patient was having CD10 positive and BCL2 positive. So what is your diagnosis? So it is based on lymphoma. So whether it is follicular lymphoma, Burkitt lymphoma, NK lymphoma. I don't know the fourth option. Was the fourth option DLBCL? DLBCL was the fourth option. Mycosis fungoidosis. What was the fourth option? I don't know. You people have to help me. Some students were saying it was DLBCL. Some were saying it was mycosis fungoidosis. So what is the fourth option? I don't know. So you tell me what is the fourth option first. I will help you in approach of this question. So while approaching this question, you should always know about BCL2. What is this BCL2 IHC? There are two types of BCL2, BCL2 and BCL6. BCL2 is positive in follicular lymphoma. BCL6 is positive in DLBCL. Although both can be positive in both of them, but basically BCL2 is more commonly positive in follicular and BCL6 is more commonly positive in DLBCL, and CD10 is positive in both of them. CD10 is positive in both of them. So based on this profile, so there should be some other clues also given in the question. So mycosis. So we are saying the fourth option was mycosis fungoidosis. DLBCL was not at all in the option. Okay, तो बात ही खत्म हो गई. DLBCL था ही नहीं तो ठीक ही है. लेकिन if DLBCL रहेगा भी, तो our option is same. The answer here is follicular lymphoma based on this profile. Based on this profile, it is there. And BCL1 किस में positive होता है? BCL1 भी होता है. BCL1 is positive in mantle cell lymphoma. Yes or no? Mantle cell lymphoma. Mantle cell lymphoma में आपको CD23 भी देंगे साथ में. CD23 प्रोफाइल भी हमेशा देंगे. यहाँ पे CD10 देंगे बचे हुए दोनों में फॉलिकुलर. सो यू शुड नो द इम्यूनो प्रोफाइल ना. इस क्वेश्चन के लिए तो सॉल्व हो गया. मे बी नेक्स्ट ईयर आपको सेम चीज इस बार फॉलिकुलर लिम्फोमा के लिए दिया, मे बी नेक्स्ट ईयर DLBCL के लिए आ जाए, नेक्स्ट ईयर मेंटल सेल के लिए आ जाए. So you should know complete immunohistochemistry profile. So take a list. It is available everywhere in my notes also, in other educators notes also. Immunohistochemistry profile is given to you for various malignancies. So take that profile in consideration. In this era of molecular genetics, na, So most of the questions are based on advanced techniques. So ISC is an advanced technique, you know. So most of the questions you can expect in future also from ISC. So ये तो एक क्वेश्चन हो गया, स्ट्रेट फॉरवर्ड था, यहाँ पे आंसर पॉलिकुलर लिम्फोमा ही है, नथिंग, नो अदर डिफरेंशियल, क्योंकि टिपिकल प्रोफाइल आपको BCL2 पॉजिटिव दिया है और CD10 पॉजिटिव दिया है। यहाँ पे BCL6 पॉजिटिव अगर होता 2 की जगह तो आंसर DLBCL होगा, लेकिन DLBCL आपके ऑप्शंस में नहीं है। तो अगर BCL6 वो देते तो ऑप्शन में DLBCL भी देते, और यहाँ पे अगर BCL1 देते और CD10 नहीं, फिर CD23 देते और CD5 नेगेटिव देते तो आंसर मेंटल सेल होता। तो यू शुड नो इम्यूनो प्रोफाइल ऑफ ऑल द लिम्फोमास। डन और नॉट? Done or not? Should I move to the next question? Next 3 questions are based on vasculitis. So students told me vasculitis was a favorite topic of the examiner. उसमें से 3 क्वेश्चन आ गए। So vasculitis usually ऐसा टॉपिक होता है, so most of the students find it कि ये तो थोड़ा बोरिंग सा है, just skip it. So it was an important topic for this exam. 3 questions arises from that topic. So let me see. Let me have an overlook one by one. So middle-aged female is there having headache and jaw claudication. So what was the diagnosis? The typical diagnosis for this is giant cell arthritis. Treatment was asked in the question. Diagnosis is not asked. Typical jaw cloudiness or headache. Let me show you a diagram. The diagram, I guess. And I'll tell you. So this is the diagram. You can see typical headache over the temporal artery distribution and typical jaw claudication. Typical. And this is the old female, middle-aged or old female. Usually occurs in females. So तीन चीजें क्लू हैं तुम्हारे क्वेश्चन में. As students told me कि मैम 3 clues were there in the question. What were the 3 clues? Middle-aged female was there. Localized headache. Localized में temporal mention था क्या? दिव्या, रवि, रजत, टेम्पोरल मेंशन था कि लोकलाइज्ड ही था, और टेम्पोरल भी मेंशन था. जॉ क्लाउडीनेस, और कोई एडिशनल इंफॉर्मेशन गिवन था क्या इस क्वेश्चन में? प्लीज टेल मी. एंड ट्रीटमेंट वाज आस्क्ड. सो फर्स्ट मेक द डायग्नोसिस देन टेल मी द ट्रीटमेंट. बिना डायग्नोसिस बनाए डायरेक्टली ट्रीटमेंट नहीं बता सकते. सो द ट्रीटमेंट इज जाइंट सेल आर्थराइटिस और टेम्पोरल आर्टरी आर्थराइटिस. And treatment is definitely, if this is the diagnosis, treatment is only one steroid. Immediately steroid देना है, because one grave complication can occur if you don't give steroid straightforward. If a patient is in front of me, she is a young lady or a middle-aged lady, she is saying, I am having pain here, doctor. Here, typically you have severe pain and I am having jaw claudication. I will do a biopsy, confirm whether it is giant cell arthritis or temporal arthritis. I will confirm it. If it is arthritis, straightforward, I will give a dose of steroid, corticosteroid, because if ophthalmic artery is involved, patient can turn blind permanently with that eye. So blindness is the deadly complication here. So to prevent blindness, we will give steroid. So Tariq Siddiqui is saying elderly female was there and steroid. Yes, steroid तो मैंने लिखा है Tariq. So instead of middle-aged female, there was the elderly. So let me correct it. Elderly female was there. तारिक, और कुछ इंफॉर्मेशन अपार्ट फ्रॉम इट? और व्हाट वर द अदर ऑप्शंस अपार्ट फ्रॉम स्टेरॉइड? 3 ऑप्शन और क्या थे तारिक? व्हाट वर द अदर 3 ऑप्शंस? दिव्या, तारिक, रजत, रवि. हेल्प मी ना, फॉर यू जूनियर्स, वी आर गैदरिंग दिस टुगेदर. तो ये सब नोट्स बना के तुम्हारे जूनियर्स को ही तो देंगे ना कि दैट वाज अ रिकॉल. यस और नो? सो दैट विल बी यूजफुल फॉर देम. यू ऑल आर गोइंग टू बी गेट सिलेक्टेड, आई नो, most of you, I guess, I wish. So yes, what were the other 3 options? So treatment पूछा था, treatment यहाँ पे तो steroid straightforward है, but I am not aware of the other 3 options it is given. So let me tell you a little bit about vasculitis in the next 2 minutes. Vasculitis is an inflammation of the blood vessel wall. So on the basis of the size of the blood vessel or basis of the type of inflammation, whether it is necrotizing or whether it is granulomatous, based on the size, whether it is large, medium or small. So 2 classifications are there. You have to learn both classification, large, medium and small. So large vessel, medium vessel and small vessel. Large में सिर्फ 2 ही आएंगे, सिर्फ 2 आएंगे, टेम्पोरल एंड टकायासु. इन दोनों पे इस साल क्वेश्चन था. एक तो ये मैंने दिखाया टेम्पोरल पे, नेक्स्ट क्वेश्चन में टकायासु भी देने वाली हूँ. So which is there in your exam? I guess most of the students told me. Medium में भी सिर्फ 2 ही आते हैं, polyarthritis nodosa, that is PAN, और Kawasaki. So and Kawasaki, these 2 medium में आते हैं. Small में बहुत सारे आते हैं vasculitis. Small में there are 2 types, अंका associated and non अंका associated. अंका positive, अंका negative. अंका positive भी है तो P अंका है कि C अंका है? Wagner में C अंका होगा, बाकी सब में P अंका होगा. So P अंका, C अंका, the 2 types of antibodies, and non अंका positive, it is in front of you. So this is the first classification. You know, अंका and P अंका and C अंका, both of them are anti-neutrophilic cytoplasmic antibodies. अंका, ANCA, that is the full form of अंका. Most of the students even don't know the full form of अंका. Anti-neutrophilic cytoplasmic body. So that is the neutrophil. So antibodies are formed against the neutrophil. So anti-neutrophilic cytoplasmic antibodies, it is of 2 types, P अंका and C अंका. What is P अंका and C अंका? C अंका is for cytoplasmic. एंड प्रियंका इज पेरीन्यूक्लियर, ये भी है साइटोप्लाज्म में लेकिन न्यूक्लियस के अराउंड. So you can see this is in the cytoplasm. Can you see these are present in the cytoplasm and these are present just around the nucleus, just around the nucleus. So Priyanka and Siyanka, you can see. And based on the inflammation, it is of two type, granulomatous or necrotizing. So if you take the biopsy of the blood vessel wall, you are finding what? You are finding granuloma or you are finding necrosis. If you are finding granuloma, it has to be these ones. And if you are finding necrosis, it has to be these ones. So giant cell arthritis and Takayasu both have granulomatous inflammation. Granulomatous. And Bragner is coming on both sides. Bragner is coming on both sides. So giant cell arthritis is given in your question. It is the most common arthritis. Usually occurs in adult females. Large arteries are involved, most commonly temporal artery and vertebral artery and ophthalmic artery. Later on, ophthalmic artery की वजह से blindness होगी और vertebral artery की वजह से arthritis होगा. So these are the complications. So mainly temporal artery is involved. Patient present. Can you see? Patient present with headache. Segmental involvement होगा. Artery thick हो जाएगी. Sometimes history में given होगा कि artery यहाँ पे thick हो गई है with severe headache. So and if you take the biopsy, you will find granulomas. Can you see? You will find granulomas. You will find granulomas. See, try to see these giant cells. Try to see these giant cells. This is a granulomatous. The three walls are shown. This is intima. This is whole media. And this is externa, the three layers of the blood vessel. This is temporal artery. And treatment, the patient will present with headache and jaw claudication. So typical history along with fever, fatigue, ये सब भी हो सकता है. Maybe तुम्हारे क्वेश्चन में ये सब भी हिस्ट्री हो. ये सब भी था क्या तारीख हिस्ट्री में? Constitutional symptoms can be there. Treatment is only one, steroid. So that is your question. Coming to the next question. Next question is in front of you. I don't know the whole question, the clinical scenario, but I'll know the gist of it. Students told me एक question था जिसमें weak upper limb pulse was the clinch. Patient was having weak upper limb pulse, but lower limb pulse was all right. So typical presentation of a Takayasu disease. Takayasu disease. Takayasu disease. This is the Takaya. It is also known as pulseless disease. So here also large arteries are involved. Adolescent girls is there. Usually young females में होता है. It is known as pulseless disease because it is also known as aortic arch syndrome. Here subclavian artery is involved. वहाँ पे temporal artery involved हो रही थी. यहाँ पे subclavian होगी. Others में और भी हो सकती है लेकिन mainly subclavian artery supplies to upper limb. तो ये इन्वॉल्व होगी तो अपर लिम्ब का ब्लड प्रेशर कम होगा. So that is the pulse. We take the pulse here. We will not find the pulse, but the person is live. Person is not dead. Person is live in front of me. I'm taking the pulse of the person. I'm not getting the pulse. I'm not getting the pulse. That is pulseless disease because the subclavian artery from the aorta is involved. So that is supplying to the upper limb. Have you got it? So that is the pulseless disease. It is same as that of giant cell arthritis. You know, giant cell और Takayasu दोनों में granulomas मिलेंगे. So you will find granulomas here also. So marked weakening of the pulse in the upper extremity is a symptom there. Apart from it, ocular disturbance and claudication, lower BP, weakening of the pulse in upper limb and more as compared to lower limb. Lower limb में pulse इतना weak नहीं होगा. Done. So correct answer here is it was the diagnosis based. So the answer was Takayasu. This is the next question in front of you. The third question based on vasculitis. A 24-year-old male having a typical scenario. The triad of HS purpura is given. Purpuric rash is there. Renal involvement is there. Arthritis is there. Abdominal pain is there. और क्या चाहिए? The typical diagnosis is HS purpura. I want you to tell me the other options क्या थे यहाँ पे. किसी को याद है? आंसर तो सबको याद है. HS purpura था. सब ये सही मार्क करके आए हैं. All the students have marked it very correctly. You know the typical triad of HS purpura. See the A. See the typical triad. So typical clinical scenario giving a diagnosis of HS purpura only. But what were the other three options? We have to complete it ना. Other three को rule out भी तो करेंगे. तो जिसको जो information मिलती है, please text me personally on my Telegram, or you can tag me there also on Let's Track NEET PG or on my Telegram group, and you can ask personally also. You can tell me information there. And last question, which is still incomplete, you have to complete it. Those who are listening, tell me the complete question. No, this is not one. इसके बाद एक और है. So a child is there. I don't know the age, what is given in the question. A child with edema, urine protein 3 positive and hyperlipidemia. Hyperlipidemia, so blood में lipids ज़्यादा थे और hypercholesteremia, cholesterol ज़्यादा था या lipid ज़्यादा था. So some question was there. So options were nephrotic syndrome, nephritic syndrome, Goodpasture syndrome. These were the options. So it is a typical case of nephrotic syndrome. It is not nephritic. So you should know the difference between nephrotic and nephritic. Let me tell first nephritic. मैं पहले difference बताती हूँ, तुम फिर question पे आना. Nephritic में patient come to you with five things. Number one, microscopic hematuria, blood in the urine. Blood in urine. That is the thing patient will run to you. Doctor, I am having red urine, blood in the urine, hematuria. Proteinuria but mild. If you do a protein analysis, protein is not visible grossly. So if you do a urine analysis, you will find mild proteinuria. You will find the patient is hypertensive. If you take the blood pressure is elevated more than 120 by 80. Patient is having edema, but mild edema, and patient is having oliguria. Urine 24-hour urine less than 400. Done. So these are the 5 things. HPOO, hematuria, hypertension, proteinuria, edema, oliguria. That is nephritic syndrome. Let me see nephrotic syndrome. Nephrotic में क्या होता है? Most common cause of nephritic syndrome is RPGN. In adults also, in children also, RPGN. Let me come on nephrotic. Nephrotic में 6 चीजें होंगी. यहाँ पे हेमेचूरिया नहीं होता, ब्लड इन यूरिन नहीं होता, यहाँ पे प्रोटीन्यूरिया होता है लेकिन मैसिव. इट इज मैसिव, इट इज नॉट माइल्ड, इट इज मैसिव. इतना प्रोटीन यूरिन में निकल जाता है कि ब्लड में कम बचता है. तो हाइपो एल्ब्यूमिनीमिया, एल्ब्यूमिन कम हो गया ब्लड में. वहां पे प्रोटीन यूरिया था लेकिन माइल्ड था, तो ब्लड में एल्ब्यूमिन कम नहीं होता. यहाँ पे ब्लड में एल्ब्यूमिन कम हो जाएगा. इडीमा, देयर विल बी इडीमा, क्योंकि प्रोटीन कम हो गया तो लिवर विल कॉम्पनसेट फॉर्मिंग मोर प्रोटीन. तो प्रोटीन की जगह वो लिपोप्रोटीन बनाएगा, इसलिए लिपिडीमिया, लिपिड बढ़ जाएगा ब्लड में, और लिपिड बढ़ जाएगा यूरिन में, और हाइपरकोएगुलेबिलिटी. सो दीज आर द 6 थिंग्स seen in nephrotic syndrome. So see your question now. What is the most common cause of nephrotic syndrome? In adults, it is membranous glomerulonephritis. In children, it is minimal change disease, MCD. So now you see your question. See your question. So in your question, I'm not going to your question again. So there was a child given in your question. The child is having edema. The child is having protein 3 plus. Protein in urine is severe. It is massive. It is severe, and hyperlipidemia or hypercholesteremia. So typical, the answer is nephrotic. Typically, the answer here is nephrotic. Okay, passing fat in the urine. Tariq has given an additional information. I would like to add it in my question for your juniors. So here in your question, Tariq, thank you very much. You have told me one more information, fat in urine. Fat in urine means lipiduria. तो हाइपरलिपिडीमिया था कि नहीं था तारिक? तो एक ही बात है, लिपिडीमिया होगा तभी लिपिड्यूरिया होगा. ब्लड में फैट ज्यादा होगा तभी वो यूरिन में जाएगा. तो यूरिन में जा रहा है तो वन एंड द सेम थिंग. डायग्नोसिस इज still same. It is nephrotic syndrome only. So diagnosis here is nephrotic syndrome. You can find out of the 6 things, you can find 3 or 4 things in the question. And यहाँ पे तो nephrotic है, अलग अलग टाइप नहीं दी है. Let me change the option. अगर instead of this अगर क्वेश्चन ऐसा होता कि membranous glomerulonephritis, membranoproliferative glomerulonephritis, APGN, RPGN और MCD, तो आंसर क्या लगाते? तो आंसर क्या लगाते? MCD, मिनिमल चेंज डिजीज. तो उस केस में क्वेश्चन थोड़ा और डिफिकल्ट हो सकता था, लेकिन एग्जामिनर ने क्वेश्चन बहुत सिंपल रखा. उस केस में मेरा आंसर एमसीडी होता, क्योंकि चाइल्ड है. चाइल्ड में मोस्ट कॉमन कॉज ऑफ नेफ्रोटिक सिंड्रोम एमसीडी होता है. तो एमसीडी होता उस केस में. बाकी सब नेफ्राइटिक सिंड्रोम कराते हैं, नेफ्रोटिक नहीं. क्वेश्चन थोड़ा और डिफिकल्ट हो सकता था, बट लकीली एग्जामिनर ने उसको थोड़ा सा सिंपल रखा. So okay, let me move to the next question. Next question, I'm incomplete with the next question. I'm getting confused with this because complete history is not known to me. Some of the students told me that there was a young male given in the question eating some fast food, junk food or burger, and no green leafy vegetables in the diet. No green leafy vegetables and fruit in the diet. Hemoglobin was less, he was anemic, and MCV was raised. It was about 110 or 120. So that was the history given to me by the students. Now you people have to add additional history. इसमें कुछ और history भी लगाओ. Of course MCV raised है, anemia. अनीमिया तो है ही ना, हीमोग्लोबिन कम है. तो एमसीवी बढ़ा हुआ है तो इट इज मिगैलोब्लास्टिक अनीमिया. सो रूल आउट द 2 अदर. तो आईडीए आयरन डिफिशियंसी अनीमिया नहीं है, बिकॉज इट इज आपका हाइपो अनीमिया है, हाइपोक्रोमिक अनीमिया है ये. तो इट इज नॉट आईडीए, इट इज नॉट सिड्रोप्लास्टिक अनीमिया. यस और नो? हियर एमसीवी, आईडीए और सिड्रोप्लास्टिक दोनों में आपका एमसीवी लो होगा. एमसीवी रेज्ड है तो इट हैज टू बी मेगालोब्लास्टिक एनीमिया. लेकिन अब फोलेट है कि कोबालामिन है? कोबालामिन इज B12. किसकी डिफिशियंसी है? दोनों की डिफिशियंसी से होता है, लेकिन कुछ एडिशनल इंफॉर्मेशन डेफिनेटली रहा होगा क्वेश्चन में, जिसकी वजह से हम टुवर्ड्स द आंसर जाएंगे. बेस्ड ऑन दिस हिस्ट्री बोथ द ऑप्शंस आर करेक्ट. नाउ इफ यू आस्क मी कि मैम इतना ही हिस्ट्री था, आप क्या करें? इतना ही हिस्ट्री था तो इफ आई से मोर कॉमन B12 डिफिशियंसी होती है एज कंपेयर टू फोलेट. इफ आई सी द स्टोर्स इन द लिवर, दोनों की लिवर में स्टोर्स होते हैं. स्टोर्स ज्यादा कम फोलेट के होते हैं. तो अगर डिप्राइव होंगे स्टोर्स तो पहले फोलेट के होंगे एज कंपेयर टू B12. B12 अपार्ट फ्रॉम ग्रीन वेजिटेबल्स इट इज आल्सो प्रेजेंट इन डेयरी प्रोडक्ट्स. तो क्वेश्चन में वीगान का कुछ मेंशन नहीं है. क्वेश्चन में ये मेंशन है कि पेशेंट हमारा ग्रीन लीफी वेजिटेबल्स नहीं खाता, लेकिन ये नहीं लिखा है कि मिल्क, बटर और घी, पनीर नहीं लेता. तो ही इज नॉट वीगान, ही इज टेकिंग प्रॉपर डेयरी प्रोडक्ट्स. तो B12 की डेफिशिएंसी होना थोड़ा सा रेयर है इफ ही इज टेकिंग डेयरी प्रोडक्ट्स. लेकिन ऐसा इंफॉर्मेशन क्वेश्चन में है नहीं, तो आई एम अज्यूमिंग कि वो डेयरी ले रहा होगा. ही इज नॉट वीगान एंड ही इज टेकिंग डेयरी प्रोडक्ट्स. डेयरी प्रोडक्ट ले रहा है तो B12 की डेफिशिएंसी नहीं होगी, इन दैट केस फोलेट की डेफिशिएंसी होगी। मीट का कुछ मेंशन था क्या क्वेश्चन में, नॉन वेज और मीट लेता है कि नहीं लेता है पर्सन, या फिर डेयरी प्रोडक्ट्स का कुछ मेंशन था क्या क्वेश्चन में, डेयरी प्रोडक्ट्स लेता है कि नहीं लेता है, या फिर कुछ इसके अलावा कुछ और एडिशनल इंफॉर्मेशन क्वेश्चन में था क्या जो हमें किसी एक तरफ पॉइंट करे। यहाँ पे कुछ इंफॉर्मेशन पॉइंट करती है B12 की तरफ, कुछ इंफॉर्मेशन पॉइंट करती है फोलेट की तरफ। व्हाट इज योर ओपिनियन, व्हाट यू हैव मार्क्ड एंड थिंकिंग व्हाट यू पीपल हैव मार्क्ड, दोज हु आर लिसनिंग दे कैन आंसर ना। तुम लोगों ने क्या मार्क किया है, B12 मार्क किया है कि फोलेट मार्क किया है, और जो भी मार्क किया है क्यों, वो क्यों मार्क किया है, what is the correct answer? So tell me the more history which is given in the question, come up, we will do a detailed analysis later on. So I am not commenting any particular answer for this question, I will do a detailed analysis of the whole path of questions again after 2 or 3 days, come up with more information with more options. Currently जो मैंने क्वेश्चन दिखाया, किसी में एक ऑप्शन बताया, किसी में दो बताया, किसी में तीन, किसी में चारों, तो एक बार पूरे क्वेश्चन की क्लिनिकल हिस्ट्री जिसमें इमेज दी है, इमेज जिसमें चारों ऑप्शन है वो देके फिर हम डिटेल्ड एनालिसिस करेंगे। उसके लिए यू हैव टू हेल्प मी, यू हैव टू सेंड मी द एडिशनल इंफॉर्मेशन अपार्ट फ्रॉम इट पर्सनली on my telegram. So either on the telegram, let's crack NEET PG telegram group is there, let's crack NEET PG, and my name is Dr. Priyanka Sachdev. So tag me there, I'm an admin there, I'm a faculty there, so tag me there, you can ask me the question there, or you can put your information on the group. We all will gather from there, and we will place another session 2-3 days later on, basically on Wednesday in a special class of Unacademy that will be free for all. So I request you to attend that detailed analysis. Till results, what you will do now, it's a party time, it's a relaxation time. The paper was relatively easy or moderate. It was not at all a tough paper, not at all a tough paper. No one will quote this paper as tough. It was relatively moderate or towards the easier side. So cutoff will be little bit high, I guess. We all are guessing, the educators are guessing the cutoff will be little bit higher. So if you have done it well, if you have not done the silly mistakes and the question was easy, you are already in. So it's party time, yes or no? But you never know. The results are always unpredictable, and it was not the last exam, so don't lose hopes. Just dust it and move ahead. Just move ahead. Just dust it there and move ahead. So move ahead, take a break for 3-4 days, refresh yourself until your results come. You should start your preparation again for the next INI-CT. Next INI-CT, we know we have INI-CT in November, we have FMG in December, yes or no? So recently I will come in 2 or 3 days, I will make a plan for these exams for you students. I will launch many free courses also, and for these 2 exams, the detailed courses in November and December, we will target these exams. I wish all of you all the best. I don't want anyone of my old students come back in my classes. I want your juniors to attend my classes, not you people. I'm wishing all the best, but the results are really unpredictable, and don't lose hopes. Don't lose hopes. And if you are not selected also, it's okay. It's okay. It's not an end. It's not a dead end कि नीट पीजी 2021 में नहीं हुआ तो अब मेरा कुछ नहीं हो सकता, ऐसा नहीं है। आगे पूरी दुनिया खुली हुई है, अगली एग्जाम बाकी है, अगले 2 महीने बाद, इट्स ऑलरेडी सितंबर, अक्टूबर, नवंबर में फिर INI-CT है। मे बी गॉड ने तुम्हारे लिए कुछ बड़ा सोचा है, समथिंग बिगर इज प्लान। सो दोज हु आर इन, माय कांग्रेट्स टू देम, you do the party. Those who are not in, don't worry, you will get selected in this INI-CT. तो गॉड ने तुम्हारे लिए कुछ बड़ा सोचा है, so that is the thing. So don't lose hopes, continue your preparation, take a break for take a chill break for 7 days at least, 4-5 days, 7 days. After that continue your preparation till the results are there. Maybe ऐसा ना हो results आते आते 2-3 महीने लग जाए और बाद में results में selection भी ना हो और इतना टाइम भी वेस्ट हो जाए, और जब रिजल्ट आए तब एकदम से INI-CT आ जाए। तो INI-CT के लिए my advice to you, तुम्हारा revision on होना चाहिए. So that is my advice to you. So see you all on Wednesday. Please follow my profile link on Unacademy. My name you already know, Dr. Priyanka Sachdev. Go on Unacademy app, search my name in NEET PG category. You will find my profile link there. Follow my profile link. You will get all my recorded lectures there. You can open any lecture free of cost. You will require a code. The code is Sachdev10. SACHDEV Sachdev10. That is my surname. So use this code, and you can take the plus and iconic subscription also if you wish. And this is a limited time offer. If you take a subscription for 12 months, you will get 2 months extra. If you take a subscription for 4 years, that is the most cost effective subscription with us. It costs 60,000 on plus and 75,000 on iconic. These are the price for various subscriptions available on the platform. So you can take any subscription, whatever your wish. You can see longer the subscription, cheaper it is. So whatever subscription you are preferring, use the code Sachdev10, SACHDEV Sachdev10. you will get 10% discount on it. Thank you. See you. Bye-bye. And study hard till the results come. Enjoy and then study hard. Okay. Bye-bye.